So my friends, because of time, I won't be saying too much on fat-soluble vitamins and water-soluble vitamins, but I thought you should know a few things about this fat-soluble, water-soluble vitamin because they can greet you in the AKT. Basically, whenever we're talking about fat-soluble vitamins, we're talking about a deck: vitamin A, vitamin D, vitamin E, and vitamin K. Well, many of you already know that vitamin A, night blindness, but many of you forget that retinitis pigmentosa, right, night blindness. Why do you forget that? It's a picture that you need to put in your head. Many of you forget retinitis pigmentosa is bony speckles. Many of you forget retinitis pigmentosa is Alport syndrome plus renal retinitis pigmentosa with renal failure is Alport syndrome. Why do you forget these things when we have played around with it? Alport syndrome comes out in the exam. Where does it come out in the exam? It can come out as far. What is far? Someone has forgotten even when we mentioned it yesterday. It is X-linked dominant, Fragile X, Alport, Rett syndrome. By the way, if you are here and you don't know everything about Rett syndrome, please, in psychiatry, when we teach it, after that day, you have to know it. Again, Fragile X, I've taught it in pediatrics. Please, is that guy, everything is fragile. He has big head, big testes, big everything. What does that? What does big head mean? Yeah, his head can fall and easily break. His head is fragile. That's how you remember Fragile X. Big testes. If his testes falls to the floor, it will crack. So his testes are big. Macroorchidism. This is how you remember Fragile X. You can see that I've not started teaching you Fragile X. Is a boy, is this. I start giving you nonsense point. No. Two things to know it in the exam. Everything is big. And how do you remember that they are big? They are fragile. Anything that is big and fragile will break easily. So remember that with Fragile X. It's a boy. You can say I'm not saying a girl. The AKT is a boy. What else causes everything to be big? I've said it so many times. It's cyclosporine. Even though we've not dealt with cyclosporine on its own, in this, if you have been in the Easy Learn, you know that my favorites are phenytoin and cyclosporine. Hyper everything. Hypertrichosis. It doesn't cause hirsutism. Why phenytoin causes hirsutism? Cyclosporine causes hypertrichosis. How do you feel it? Well, I just thought I should talk about night blindness, but vitamin A, all that concerns vitamin A is not night blindness. Vitamin A deficiency, night blindness, but think of xerophthalmia keratomalaysia. It comes with vitamin A. Sometimes vitamin A excess is a problem. So think about all those xerophthalmia. They can have it as well. The one candidates know is the night blindness. The one they don't know is the xerophthalmia keratomalaysia. We'll talk a bit about vitamin A in drills, and I'll ask you a few questions, questions that have been pictured out, a question that has a picture, a question that has a body. I'm going to ask you like that. Well, just for teaching purpose, know that night blindness and xerophthalmia keratomalaysia is vitamin A related. Well, whenever we're talking about vitamin A, please, whenever you see vitamin A in AKT, be careful. Pregnant woman, don't give her more than 10,000 international units per day. What do I mean? Over 10,000 international units per day in a pregnant woman is overdose. Well, I like to tell you why. Some training courses, they will just tell you, don't do this, they move on. They say this is a red flag, they move on. For me, I try to tell you why, because it creates a mental image for you. And that image is what forms a picture when you see a question in future. Is teratogenic. If by now you don't know Samacap and Sorsac, I will do it in drills. I may do it this afternoon. Samacap, Sorsac. Sorsac are the medications to avoid in a pregnant patient. One of it is sulfonylureas. Don't give a pregnant woman sulfonylureas. What are you doing? The GMC will always knock at your door if you give a patient retinoids. And what is retinoids? It is your vitamin A. They are related. That's why I say teratogenicity is the problem. So your Sorsac are the medications to avoid. ACE inhibitors. Why do you want to give when you know it causes renal agenesis? You can say I'm not just saying, some people will just say don't give ACE inhibitor, don't give sulfonylurea. I'm telling you why. It keeps it better in your brain. ACE inhibitor, renal agenesis. You give birth to a child. In fact, before you give birth to the child is not producing urine, and that's why there's no amniotic fluid. The mom is wondering why she has oligohydramnios. It's ACE inhibitors. It's teratogenic. The only one that you can even still try to use is enalapril. The guideline for some reason allows enalapril. Every other one is a no. They are teratogenic. And now that I said enalapril, someone is saying, I can't even remember the antihypertensives in pregnancy. What are you doing? Labetalol first line. If the patient have asthma, think about something else. Methyl-dopa can be the answer. Nifedipine can be the answer. Now that I've mentioned nifedipine, someone is thinking, where else have I heard about nifedipine? Nifedipine is one of the medication that must be prescribed by brand. Calm Light. Someone is saying, how are you just going into all these things? This is how your brain has to think. My brain is thinking like this because it's firing. Your brain has to fire when you are in the mood. When do you need your brain to fire? In the mocks. When do you need your brain to fire? In the AKT. When do you need your brain to fire? In the drills. If I'm asking you for, let's say we're talking about one of the immune granulomatous condition, sarcoidosis, and I say give me 18 points, and your brain cannot fire and give me 21, what are you doing? I pitied you by asking you to give me 18. I want to see your level. You should at this time be giving me 21. Be starting your point with hypercalcemia is related to sarcoidosis. Be hitting me that ACE levels are high in sarcoidosis. When I want to go pull me back, you tell me that one of the treatment for sarcoidosis is steroid. By the time I want to go tell me the stages of sarcoidosis, you tell me that they are in 4 stages, and the first stage is not anything to worry about. But interstitial bilateral hilar lymphadenopathy is this one of the findings in the classification of sarcoidosis. If you tell me that, well, they may have osteoporosis, but I will not give them calcium, instead I'll treat them with vitamin D, I will be happy. Why will I be happy? They already have hypercalcemia. How do you want to give a patient that has sarcoidosis calcium? It's a no. GMC will look for you, my friends. This is how to think. From here, you go there. From there, you go here. If you are starting to spend hours on one topic, you are planning to fail this exam because you need to cover everything. You need to know something about everything. And the something you need to know about everything are the most important points. So you can see that vitamin A now has led me to many things because there are too many things there. The first thing it led me to is retinitis pigmentosa because they are linked by night blindness. The next thing led me to is sore sac because they are linked by contraindications. By the way, one of the things in sore sac there is that a patient on warfarin, you need to be careful. You need to be careful. The W in sore is warfarin. Don't give it to a pregnant woman, please. Try any other thing. Try the drugs. That warfarin, don't give it to a pregnant woman. You are looking for trouble. You are looking for trouble. Some psychiatric medications, you need to avoid them in pregnancy. We'll talk about them. I want to stimulate you that the AKT is a little here, a little there. Some candidates said after the mock yesterday, I have a lot to do. Well, it's only a lot if you are planning to read things as big topics. It becomes simple when you want to do a little here, a little there. Because how does it come out in the exam? It's a little here, a little there. How do I mean? Your question A is on vitamin A, gastro, but your question B is on asthma. And they're asking a question about occupational asthma, and you don't know that it's 4 weeks. I asked some candidate about occupational asthma. One said 2 weeks, another one said 8 weeks. It's 4 weeks. How do you diagnose it? At home, they are better. At work, they are not. How do you fail these things? Well, the third question, they move from respiratory, they go to pediatrics, they ask you about Fragile X, and you fail it. Well, they thought that, well, the first 3 questions they've asked, they are too difficult. They move to hematology. They ask hereditary spherocytosis, you still fail it. What are you doing, my friends? What are you doing? They want to help you. They go to gynae. They ask about sad moms. when we give 5 milligram folic acid, you are thinking, after I've told you sad moms is sickle cell disease, I told you sad moms is thalassemia, I told you sad mom is that woman on anti-epileptic, I told you sad mom is diabetes, I told you sad mom is malabsorption, I told you sad mom is obesity, I told you sad mom is neural tube defect. You still fail it in the exam. Have you not done me a disservice? Have you not done the easy learn community a disservice? Have you not done yourself a harm? Well, I just thought I should mention these 2 points. There are a few other points, but these are the top points. Know the deficiencies, know when you take too much, what it causes, but most importantly, pregnant women, vitamin A greater than 10,000 international units is a no-no. If you can avoid it, just avoid it. If it's better, don't give it. The woman will sue you. GMC will come to you. Okay, ADEC, vitamin D, super high yield. I don't need to talk about vitamin D. I've been talking about it. I talked about it in primary hyperparathyroidism, CPP. If you don't know that acronym, CPP or CUPP is your what happens to your calcium, what happens to your CAPP, what happens to your alkaline phosphatase, is what happens to your parathyroid hormone, is what happens to your phosphate. So I've talked about it. Vitamin D are friends with calcium. Vitamin D, calcium, and parathyroid hormone are best of friends. That parathyroid hormone is it has four units in the gland. And anytime it's struggling, maybe due to hyperplasia or due to a tumor, is supported by vitamin D. Is supported by calcium. So you need to know it. So I think I shouldn't talk too much about vitamin D. I mean, the only few things I should mention is that in vitamin D, phenytoin is a medication related to vitamin D. It has come again. Someone says, "Oh, Dr. Ola likes the phenytoin." I don't like it, but how come that in your January exam you see phenytoin because it's high yield? In your April exam you see phenytoin is high yield. In your October exam you see phenytoin is high yield. How did I know? Phenytoin is too common for you not to see it in the exams. Even the people setting the exam, they will think and they say, why should candidate not know about phenytoin? We'll ask it in 3 exams. We'll continue to ask it because everything about phenytoin is high yield. You need to know it. Even if it's a specialist medication, you need to. It's this kind of medication that you need to spend your time with. Not the medications used to treat hemochromatosis. Not the medication need to treat Wilson's. Don't spend too much time with that. Spend time with phenytoin because questions are too many. So again, it has come to you. I've mentioned it 3 times today. It keeps bringing out its ugly head for people who don't know it. For people who know it, they have its medication. Anytime it comes, they say, oh, it's phenytoin again. They give it phenytoin. It goes back to rest. Phenytoin is known by phenytoin. The acronym phenytoin is for phenytoin. If you don't know it by now, I've said it again and again. Come to the drills. That's what we do there. So a patient on phenytoin think that phenytoin can cause osteomalacia. It is due to enhanced vitamin D metabolism. But can I give you a picture again? In patients with phenytoin, in patients with vitamin D deficiency, in children think rickets. In adults think osteomalacia. Osteomalacia picture, you need to know it. I've told you osteoporosis, everything is normal. We did that. I asked one candidate, all the 7 of them. He got some, he didn't get some. We revised it. I asked him again, he got all. I went on and asked another candidate. If you are missing the drills, you are missing nearly all. Missing the drills is missing the deal. I say that every time. The drills is the real deal. Missing the mocks, I don't know how you want to learn how to think in the AKT. You see many candidates were very unhappy because their way of thinking didn't work for the AKT. Then you have to change it. And it's only the mocks that allows you to see that your way of thinking is not the way of the AKT. And that's why people are failing the AKT. They carry their way of thinking. They carry their way of thinking for previous exams into the AKT. The AKT is not like that. You need to think postgraduate. You need to think fast. You need to think smart. You need to be streamlined. You need to be able to dodge or any loopholes. You need to be able to jump it. My friends, don't fail the AKT because of technicalities. People fail the AKT on technical grounds. People fail the AKT because they carry past attitude into the AKT. Learn the attitude of the AKT. Learn the way the AKT wants you to answer it, and then you pass the exam. Well, I just thought I should remind you that vitamin D is everywhere. And today I'm just going to talk about it too much because it's everywhere. As I keep talking about other topics, I keep bringing it up. So let me just go away because it's almost time or time is up. Well, vitamin E can come in the AKT. Again, vitamin E, think about neuromuscular problems. Think about neurologic problem. Vitamin E is a cause of peripheral neuropathy. Don't fail the question in the AKT. When anytime you hear about peripheral neuropathy related to vitamin, think vitamin B1, thiamine. Think vitamin B12, cyanocobalamin. Think vitamin E. Vitamin E is a cause of your peripheral neuropathy. Well, a patient who is having dry skin, their skin is not very oily, vitamin E can be the cause. Don't fail it in the exam. Don't fail it in the exam. You can basically see vitamin E picture everywhere. But because of time, I'm not going to go deep into this. They probably will not put vitamin E as a question on its own. They may use it as a way to link another question. Just know everything about vitamin E. It is one of the fat soluble vitamins. By the way, the fat soluble vitamins stay longer in the body because they are stored in fat. But how can a patient have fat soluble vitamin deficiency? It's because of malabsorption, my friends. Malabsorption is a cause of fat soluble vitamin deficiency. How does malabsorption come? The exocrine gland in the pancreas is responsible. If the exocrine gland in the pancreas starts to have problem, the patient starts to have malabsorption. That is in chronic pancreatitis. We're going to deal with chronic pancreatitis as one of the things in gastro. Is going to be in gastro 3. So the things you see in gastro 3, you see primary sclerosing cholangitis in gastro 2. You see primary biliary cirrhosis or cholangitis in gastro 2. But when you go into gastro 3, you start to see liver things, hepatitis picture. You start to see liver cirrhosis. In that place, you see every other thing that is not taught in gastro 1, gastro 2, you see them in gastro 3. So, my friends, vitamin E is everywhere and you need to be good. You need to know how the questions can come. We'll do that in the drills. ADEC is vitamin K. Well, you see, vitamin K's use in the AKT is bleeding. Is bleeding. If not because of time, I would have told you that a patient on warfarin, what do you do when warfarin is above 5 with bleeding? What of above 5 without bleeding? That's 5 to 8 with bleeding, 5 to 8 without bleeding. What of if it's above 8? What do you do with bleeding? What do you do when without bleeding? Please come to the drills. It's already part of the drills. It's not something that we're thinking about. It's part of your drills. So come to the drills. Let's talk about it. Let's have some time together. Bring your coffee. The drills are chilled. You can be eating while doing the drills. Let's talk about what happens when when the warfarin level. That's why I mean the INR. Someone is asking what do I mean by warfarin level. At this time, when I'm saying that, it's INR I'm talking about. By the way, if you don't know all the things about INR in the AKT, there are 4 of them. When do you use INR? What's the difference between a mechanical heart valve and a biologic heart valve? A mechanical heart valve, give it to young children. Biologic heart valve is for someone in their 70s. Biological heart valve, they don't stay long. They are destructible. After 20 years, you need to change it. But by 20 years, this man is dead. By 20 years, this man is about to die. So give him a biologic heart valve. But a child is someone that has a heart problem at the age of 23. How do you go start taking that patient for recurrent surgeries? You do 3 surgeries in their lifetime. No, that's not fair. Give them a mechanical heart valve. What type of coagulants do you use? What do you use? Warfarin? Do you use DUAC? These are some of the things we need to discuss. You need to know the INR for each of them. Which one is 2? Which one is 3? Which one is 3.5? Which one is 2.5 to 3.5? These things are confusing. Some candidates have them at their fingertips. Other candidates are simply, they don't have that picture. We'll create that picture in your head in the drills. So vitamin K, I've told you, it comes when there's bleeding in an adult. But I've not told you that a new child that is having bleeding diastasis, what's that? My friend, hemorrhagic disease of the newborn is an AKT question. Someone is saying, oh my God, there are too many things to learn. Learn it in bits. Learn it as a little here, a little there. You would enjoy it. If you go and read hemorrhagic disease of the newborn 1 page today, you are harming yourself. Read hemorrhagic disease of the newborn, read treatment. The phyto there's a medication from vitamin K. So it's, I can't remember the name, but it's phyto something, or it's naftaquinone. That's it. Naftaquinone is the treatment for it will be the treatment for a patient with hemorrhagic disease of the newborn. But if you go and read it, just read the management, read how it presents. That's all. 2 minutes, leave there. Then don't just read it, have a big jotter. For my AKT, I had a very big book. It was 100 pages, but by the time it was time for AKT, the whole of AKT was not up to 50 pages in the book. It wasn't even up to 40 pages. That's why I say, if you have 4 jotters, 100 pages each, and they are all full, so you have 400 pages to read for the exam, you have planned to fail the AKT. I'm telling you, you will probably fail the AKT because you cannot revise those things. So hemorrhagic disease of the newborn, 1 line. And you put that 1 line under gastro. If I were you, I'll put gastro. Hemorrhagic disease of the newborn, 1 line. Hemochromatosis, 1 line. Wilson's disease, 1 line. Causes of dysphagia, 3 lines. And I'll be going like that. At the end of a gastro 1, 2, and 3, the whole of gastro is 2.5 pages or 2 pages. You can read that. But by the time you are reading that, you have covered all the high yield points. Some candidates are feeling defeated because while I was saying this in August, they were saying, well, my brain is a photographic brain. I won't write anything. Now they want to start writing. They discover that they've missed quite a lot. They are going back to the videos. It's becoming too cumbersome. Well, don't bother about writing again. Please revise your mocks. Your mocks makes things easy. You can see the mocks. They have things like Mafans is Mafans. And that's the only thing we put in the answer. We don't want to put so many things. We just put the points. So just go to the mocks, revise them. 1,000 of them. We've done a few mocks. If you don't know, we've done some teaching mocks in cardiology. We've done some picture test mocks during your during your charity period. So all those mocks, any mock that you can gain from, just look at it. Mocks are very good. They teach you how to think. At the same time, they give you points. So they do double. Is a double measure. Double things happen when you look at mocks. Well, that's the fat soluble vitamins ADEC. I've told you what all of them stand for in the AKT. I've told you what you need to do, what you need to know. I've told you about vitamin A in pregnant women. And I've told you that fat soluble vitamins, think about chronic pancreatitis as a problem when they are deficient. That's the exocrine function of the pancreas. It can be cystic fibrosis. Cystic fibrosis is a cause of malabsorption. Cystic fibrosis in children presents as stunted growth. Cystic fibrosis comes with hypothyroidism. Cystic fibrosis comes with shortness of breath. Cystic fibrosis comes with subfertility in females, infertility in males. Cystic fibrosis comes as diarrhea. Cystic fibrosis comes as steatorrhea. How do you feel these things? The last time I looked at cystic fibrosis is about 1.5 years ago. I've not looked at it, but I can't forget it. Each time I talk about cystic fibrosis, you always hear me talk about Lome factor or CAMBI. The long hand of the chromosomes, I always talk about it. Each time I talk about cystic fibrosis, I talk about the organisms. Capicia, Bocodera capicia, I say is a contraindication to lung transplant. Some candidates will fail it. I say staph is one of them. It's CAPS. Capicia Bocodera is the C. The A in the caps is a patient that has aspergillosis. The P in the caps is Pseudomonas, and the S is staph. Someone will still deliberately go and fail the organisms that worry patients with cystic fibrosis. Meanwhile, I don't see why you'll be reading or revising cystic fibrosis and you won't go into Katagana syndrome. It's SIP. The patient with Katagana syndrome, they have situs inversus. The patient with Katagana syndrome can have the heart that is supposed to be on the left, on the right, dextrocardiac. The patient in Katagana syndrome, they have infertility, my friends. So you can't fail these problems. You can't fail these questions in the exam. And how do you do these things without talking about bronchiectasis? You need to know the organisms in bronchiectasis. I asked a candidate, tell me the CT scan finding in bronchiectasis. He was still thinking. Tram track lines is something not to think about. It's on CT. Sometimes if you are lucky, you see it on chest X-ray. I asked another candidate to tell me about the management of bronchiectasis. They were thinking. Some candidates are here, they are still struggling with CRB 65 and COP 65. What are you doing? These things pain me a lot because we spend a lot of time trying to invest to make sure that you understand the clinchers and the clinches. It pains me because if you fail it in the AKT, the effort has been wasted. The effort has been wasted, both on your side and on our side. Do you know what will happen? On our side, we will just be pained. But on your side, what will happen is that you will take these pains again to prepare. And you all you need to do is ask for people that have failed the AKT. Go and ask them. Just phone one person that you know that has failed the AKT. Tell me, how does it feel to write the AKT again? It's painful. It's painful because you start the preparation from scratch one. There's no continuing. You are going to have to, because you failed it for a reason, you have to check your strategies again. It's starting from the scratch. Why don't you just pass it now and pass it once? Okay. I just thought I should challenge you a bit because I don't want anybody. I want 100% pass for easy learn. Is it possible? It is achievable. Is it achievable? It is already almost done. It's dependent on you now to ensure that all these clinchers and cliches you use them. It's dependent on you to know what super clinchers are and use it to save your time. It's dependent on you to understand picture recognition, what we call pattern recognition. So, my friends, water soluble vitamins can come out in your exam. The common ones are the vitamin B complex and the vitamin C. B1 termine is coat and rack. How do you feel it in the exam? If you've not heard me say coat in the AKT, I've said it 10 times. If you've not heard me say rack in the AKT, I've said it 15 times. Confusion, ophthalmoplegia. Ataxia, it is time to take termine. How does the question come? Is an alcoholic. If he's very unwell, he's starting to have all those symptoms in 72 hours. What am I saying? A candidate is still thinking, what does he mean by those symptoms in 72 hours? It's delirium tremens, my friend. Stop thinking. This is the picture that your brain has to bring out before I even say it. As I'm saying 72, you should know all the 72s in the AKT. Within 72 hours, if you need to give treatment for shingles, give it. Within 72 hours, if you need to give treatment for Racine-Horn syndrome, give it. Within 72 hours, treat that patient that has Bell's palsy with steroids. That is 72, rule of 72 in the AKT. Someone is saying, how did I just get there? Please, if you are not getting there like how I'm getting there, you need to work hard. You need to work hard. And work hard is not by reading. Join our drills. Work hard is to join a group. Someone says, I'm still writing my AKT in January. Join a group now. Now is the time to join a group because you need some time. You don't want to do what we call rush work. You don't want to be under too much pressure. Somebody says, oh, right, oh, this my clinicals, I'm too busy. There's a lot of portfolio work. Please, even if there's a lot of portfolio work, you're not writing AKT in October, do 30 minutes of reading a day. Consolidate your knowledge. Well, I just thought I'll tell you about B1 coat and rack. Rack is retrograde amnesia, antegrade amnesia, confabulation. The patient will be talking nonsense. This is all what we call Korsakoff psychosis. How do you see it in the exam? They don't write rack, they don't write coat. They say the patient's eyes are not coordinating. One eye is abducted, the other eye is adducted. Someone is still thinking, what's that? It's ophthalmoplegia, my friends. One eye is looking the other way, the other eye is looking another way. It's ophthalmoplegia. Multiple sclerosis is a cause. Now that I've mentioned multiple sclerosis, someone said, have I heard that topic before? My friends, if you don't know the 4 eye symptoms in multiple sclerosis, don't go to the exam. They will ask one of them. Optic atrophy is one. Optic neuritis is another one. Please, that patient that enters the sunlight and starts to have blurry vision is Otto's phenomenon. Why do you feel it in the exam? If you see optic neuritis, it's red-green desaturation color problem. Well, Lemite sign is not an eye symptom, but when the patient flexes their neck, they start to have pins and needles. How many times will I tell you that in the AKT, you will see multiple sclerosis presenting with bladder problems? What you need to do is an ultrasound. Do they have residual or do they not have residual urine? If they have residual urine, it's intermittent self-catheterization. If they don't have, you can use any of your other medications. The patient is having leg problems. You because the patient is having some pins and needles in their leg, then you are now choosing motor neuron disease. You need to be careful. Motor neuron disease, know how it presents. There are three types. Amyotrophic lateral sclerosis is the commonest type. What's the half-life of the patient with motor neuron disease? Within 3 to 6 months, many of them die. How do we preserve their life for a bit longer? Relozo. Someone is saying, how have I gone to neurology? That's the AKT. Your question 4 is gastro. Your question 5 is neurology. They have no joy. This is why you have to be ruthless when tackling the AKT. In the mocks, some of you are smiling with the AKT. You are not ruthless. Some of you have not begun to understand the AKT, and I understand that's your first mock. By the time you see 200 questions, you start to sweat. You understand the picture of how the AKT is, unless you've not done it the proper way. You sit in a quiet room, you are under that time pressure, and you are answering the questions just like you answer in the AKT. You begin to understand why you need to be ruthless for the AKT. Ruthlessness is not studying one topic a day. Ruthlessness is studying 20 topics a day. That's why in the drill, sometimes we cover 30 topics. We go here, we go here, we go here, we go here. Before we know, we've touched 30 topics. That is ruthlessness. Well, if you don't want to be ruthless, I will teach you how to be ruthless. We'll push you to be ruthless. At some point, we may force you to be ruthless by our actions, not physically. So how do we force you to be ruthless? In the AKT, they may ask antioxidants. They ask what's one of the management for dry age-related macular degeneration. You will never see the answer on the roof. You will never see the answer on the wall. It's ACE, vitamin A, C, E, and zinc. Is one of the things that they give to a patient with dry-related macular degeneration. By the way, someone is saying dry. What makes it dry? Please, no drusen. Drusen. How come you're in this class and you don't know how macular degeneration presents? It's the commonest cause of blindness in the UK. So why are you just learning it in EasyLearn? You should know. If you know glaucoma, you know cataract, how come you don't know macular degeneration? That's what many of these people who are 70, that's what they have. Wet is the one that causes the blindness, my friends. If you leave dry becomes wet. By the way, I was talking about vitamin B1. There's wet vitamin B1, berry. Someone is saying, what's that? My friends, I'm trying not to leave you to read many things, but we cannot cover everything. I can only mention it. Some of the things I'm mentioning is not because I just want to show you that I know it. It's not because I just want to show you that you should know it. I'm saying it because I want you to go and read it. We couldn't cover it in the class. I mentioned it because it was not part of the scope of things. It's not that very high yield compared to the other things I'm trying to project. So it's not for fun, my friends. Wet and dry berry, wet and dry vitamin B1 deficiency. Go and know it. Berry, you need to know it. Well, if you know coat and rack, you know berry, but you don't know that very unwell alcoholic patient should be having Pabrinex instead of oral thiamine. Why do you fail easy question? That's a question for you. Why did they put option C, Pabrinex, and you are still insisting that it has to be option A, thiamine? Because thiamine is also an option. Both of them are the same time, I know. But did you read the question? That patient is unfit to be in the community. And thiamine is the treatment in the community. Diazepam is a treatment in the community. Chlordiazepoxide is in the hospital, my friends. Diazepam is to community as chlordiazepoxide is to hospital. You can use diazepam in hospital, but chlordiazepoxide, try not to use it in the community. Use it in the hospital. If you need to give something, diazepam is easier. That's the same way Pabrinex is to hospital as thiamine tablet. It used to be vitamin B co in the past. They changed it to thiamine. Don't go and fail it. Option E is vitamin B co. Option B is Pabrinex. Option C is thiamine. A candidate chooses thiamine and is arguing, saying yes, it has to be thiamine. Don't do that. There's something in the question that has made it Pabrinex. This is what I want you to think about. Look at the question. Look at the question. The question is the only reason that you get the answer. The question is your clue to getting the answer, please. Well, I've tried my best to tell you that people fail because there are certain things they put inside the question that makes one option wrong and the other option correct. These things are the gem to passing question, and that's the only reason why people fail. Someone has failed 30, you look back at the 30, you see that the candidate has picked an answer that is very similar to the correct answer, but there was something that made that answer wrong. That candidate has played it down. That candidate hasn't looked at it. That candidate does not understand clinchers. Well, you've done B1. B3 is equal to D3. We're doing B3 equal to D3. Some other candidates said, no, B3 is equal to D4. I said, what's D4? They said death. I laughed. Well, we can always laugh about these things, but in the AKT, are you able to laugh? If you can't laugh in the AKT, start to work hard now. If you were doing the mocks and you were not laughing, start to work hard now. I looked at the scores. Only one person got 41. Most of the other people scored about 30 or below. If you were not laughing during that mock, please, what you need to do in this thing is to start to work hard so that you can laugh in the big exam. The big exam is the AKT. Start to laugh. So B3 nursing is equal to D3. What is D3? Is a 65-year-old man that has now presented with diarrhea. He has rashes on his skin, and this 65-year-old man, his wife is worried. The reason she has come is not the diarrhea. The reason she has come is not the rashes. The reason she has come is that he's not coherent. The things he's saying doesn't make sense. The actions he's doing, he's keeping things in different places. What's that? Dementia. B3 equal to D3. Dementia, diarrhea, dermatitis. How do you fail it in the exam when things have been made so easy? Nursing, B3 equal to D3. Well, I stopped there. It's not very high yield. I just thought I should let you know how the question will come. Now that you know, you decide whether to get it in the AKT or not. Can I tell you that B6 is one I've just talked about? Isoniazid, pyridoxine. What do they do? Isoniazid causes peripheral neuropathy. By the way, someone here doesn't know the side effect of isoniazid. Is the acronym, is the representative of isoniazid that helps you remember it, INH. If you check the BNF, isoniazid is represented as INH, and those are the side effects. What else do you want? What else do you want? H is hepatitis, the N is neuritis. I can't remember the I now, but if I remember, I'm just going to put it on the group. But any of you that remembers, please tell your mates or put it on the group right now. Remember these things with codes. Remember them with something. INH. But by the way, it causes peripheral neuropathy. Peripheral neuropathy. Don't fail it in the exam. Don't fail it in the exam. And that peripheral neuropathy, the N is neuropathy, sorry. Or neuritis actually. That peripheral neuropathy, if you want to prevent it, give vitamin B6, pyridoxine. Well, one of the things I thought I would say about vitamin B6 is not very high yield, but it can cause seizures, especially in the neonatal period. So there's pyridoxine deficiency causing seizures. What's that? There's a condition called homocystinuria. The problem that they have is that the children cannot absorb vitamin B6, pyridoxine. So homocystinuria that is related to pyridoxine deficiency, what you need to treat their seizures is to give vitamin B6. By the way, I just remembered the name of nursing, the disease nursing, because it's called pellagra. Dermatitis, dementia, diarrhea, pellagra. Well, let me not waste too much time on that. Please know all these things I've said. Management of epilepsy in a young child with neonatal seizures, pyridoxine deficiency. So pyridoxine B6 can be the answer. B12. Can I stay on B12 for a while? B12 and B9, so there's no B9 on your screen. It's supposed to be there, but B9 and B12 are together. While B9 is folic acid, I've told you about sad moms. You need to know that very well. 5 milligrams folic acid, neural tube defect. That's what you are preventing. B12 is cyanocobalamin. Cyanocobalamin, I describe it as the father of B9. Why? Without B12, B9 metabolism is difficult. So let's talk about the father. Well, you see a patient, the patient is having B12 deficiency. What do you think? They are vegans. Don't force them to eat meat. What you need to do is advise them. You need to take food. There are certain foods that are rich in vitamin B12. What do I mean? Yeast. mamads. Some things are rich in vitamin B12. What do I mean? Fortified breakfast. If you read on it, you see fortified with vitamin B12. So advise them to take those things. But you can see a pregnant woman in the AKT, she has B12 deficiency. This is what you just need is dietary advice. Dietary advice. A breastfeeding mom, they can have B12 deficiency. Dietary advice. If that's not working, prescribe vitamin B12. Remember, in the AKT, cyanocobalamin oral, you need to be careful. Do they have intrinsic factor positive? The new test to do is parietal cells. Is it positive? If it's positive, please give IM hydroxycobalamin. That's the answer in the exam. Well, someone is saying, I remember hydroxycobalamin has a catch. Is how to give. In the first 2 weeks, it's 3 times weekly for 2 weeks before you start giving 3 monthly. How do you fail it? By the way, it's a little here, a little there. There's an admin in it. There's something called patient-specific direction. I hope all of you have heard about it. There's also patient group direction. I hope all of you know about it. Patient-specific direction is what allows a healthcare staff to administer certain medication without having to bother the doctor. Dr. Ray, can you prescribe hydroxycobalamin for this patient? He prescribes. Because it's 3 times a week, you go on Wednesday. Because it's 3 times a week, you go on Friday. Because it's 3 times a week, you go on Monday. Dr. Ray will be tired. What are you doing? Patient-specific direction allows that healthcare staff, that nurse, that practice nurse to administer hydroxycobalamin without disturbing Dr. Ray. Which one is patient group direction? That's how healthcare staff were able to administer COVID vaccine around the UK without having to sign every single COVID vaccine in the UK soil. This is the difference, my friend. Keep things simple. Keep things simple. Well, I thought I should let you know that vitamin B12, megaloblastic anemias, vitamin B12, peripheral neuropathy. Don't fail them in the exam. Vitamin B12 comes in Crohn's. I will mention it when I get there. Vitamin B12 is in celiac. By the way, the commonest complication of celiac disease is iron deficiency anemia. How do you feel it? Now that I've told you, know 50 causes of iron deficiency anemia and dive into each of them. So celiac is one of the ones to dive into. In fact, all the topics that cause iron deficiency anemia, majority of them are high yield. Why don't you play around with it? Some worms can cause vitamin B12 deficiency. Someone is saying worms. Yes. It's not only iron that worms affect. Vitamin B12 can be affected by worm. What type of worm is that? Is the broad tapeworm. The broad tapeworm is a cause of vitamin B12 deficiency. Don't fail it in the exam. Which other worm is that? There is what we call a fish worm. Fish worm is also called the broad tapeworm. Don't fail it in the exam. If you see it in the exam, that's your answer. Pick it, move on. They can cause vitamin B12 deficiency. Because I promised that I won't stay too long and I've already stayed too long, I need to apologize to you guys. I'm so sorry. Sometimes you know that you're not going to continue in the next class. You know that the drills are already full. You know that there's only a limited amount of things you can do in the drill. Otherwise, it will be overload. Otherwise, people don't understand. So what do? You try to push a bit. You try to beg. And that's why I'm begging you now. I'm so sorry that I've kept you. Let me just say the last point and we go. There are many other things. I've told them to cut the slide. There were 6 other topics we were supposed to do today. By the time I looked at the time, I said cut everything because I need to teach. I need to teach a little here, a little there, so that the candidate is not concentrating on vitamin B1 for 2 hours. It's counterproductive. Well, vitamin C discovery is what everybody knows. There's something called hyperfollicular keratosis. The follicles, there are a lot of pigment around it. They can show you a picture in the AKT. How do you not know that bleeding gum is vitamin C? What are you doing? What are you doing, my friends? Vitamin C, you see a scattered teeth. You are looking out for growth hormone. You can't see that it's not acromegaly because the interdental spaces are is not well arranged. Everything is scattered. So what else can be the cause? It's discovery, my friends. Discovery is vitamin C deficiency. I meant. Well, you are seeing a patient with edema. You've investigated, it's not heart failure. You've investigated, it's not beasting. You've investigated, it's not peripheral artery disease. You've investigated, it's not a medication. You've investigated, it's not trauma. What is it? What is it, my friend? It's vitamin C. It causes edema. It can cause edema. It can cause the ankles to be swollen. How do you not know these things? My friends, let me stop here. Let me stop here because there's no time. Otherwise, I can keep running my mouth, slide or without slide. If you leave me today, I stay till 2, I run my mouth. Topics are everywhere. Just leave the screen blank for me. I continue to run my mouth. These things I'm running my mouth for, they are not just because I want to say it. It's because they will greet you in the AKT. They will say, welcome. They will be your question 101. In the drills, if you have plenty questions, bring all of them, write them down on a paper. Let's tackle it together. I don't know everything. I learn from you guys as well. Let's open the guideline. Let's see some of these things. Bring your questions. Some of them will pop out in the exam. It will be very painful that it was a question, but you didn't ask. So if you have any pressing question now, you can ask quickly. Otherwise, we'll call it a day. Any question? Okay. If there are no questions, I want to thank all of you sincerely for joining the class. My name is Olale Kongugwemi, and I've done this presentation on Gastro 1. We'll be doing Gastro 2 at some point in between. But we sometimes use pictures gotten from Wikipedia, Google, and other sources. They are not ours. We want to thank them. We use some materials from other sources. They are all for teaching purpose. We don't claim them to be ours. We just want to thank them and appreciate them. So I'll just thank you. Our class in the afternoon is by 1 o'clock. It's a short class. We want to do a bit of respiratory drills. One of our next topics we are looking at is respiratory. We've not touched it at all. So we still have pediatrics to go. We still have respiratory to go on my side. There are other teachers going to teach other things. Dr. Mosu is going to come and take you psychiatry and take you one or two other things. Wanwuri is coming to teach you. She's going to teach maternal health. She's coming up soon. And she's going to teach you statistics too. So we've still got a few more topics to go. But time is going. Don't wait for the topics. Don't wait for the topics. You see that some of the things you saw in your mock, we've not even touched it, but we've touched it. We've not touched it as per teaching, but we've touched it as per a drill. We've not touched it as a drill, but while I was teaching, I've run my mouth on it. Sometimes I've not run my mouth on it, but I've just mentioned it in passing. So we've touched it. In fact, I'm trying to tell you that we've touched so many things. That's why sometimes, if you have time now, I advise don't listen to the videos in October. 2 weeks to the AKT, leave it. This is the time to listen to the videos, because the videos, you can see that we are doing gastro, but the videos has way more than gastro. The videos have the things you should talk about. The videos have the things you should be knowing. That's why the notes will come bare. The note is a crammer package. The note is not very good. The note is better with the videos. So listen to the videos. We have started to cut the videos into topic by topic because we want you to be able to play them in your cars. We are changing them to audio. Please don't fail questions in the AKT that has been taught in EasyLearn. So I want to thank you very much. We'll do our 1 hour or 1 hour 30 minutes drill in the afternoon. I'll see you all in the afternoon. Thank you and good morning.